Welcome back to another episode of Practice Underwater, and this is Suzanne. Today, I have a special episode. I have a very special guest with me today. I'm so excited to introduce one of our shared practices coach, Caitlin Shoemaker. Caitlin, welcome. I'm so excited to be tag teaming with you today.
Oh my gosh, thank you so much for having me. I am really excited to be here and on air for the first time.
This is awesome. So we're going to do the George and Matt thing. We're going to tag team. How does that sound?
I love it. Let's do it.
Okay. So I feel like I want to share with the audience a little bit of history here. You were our very first hire. When we decided we were going to start a coaching department, you were our first hire. So tell everybody a little bit about your background.
Yeah, so I got out of college at 21 and didn't really know what industry I wanted to get into. And I ended up applying to a dental position, front desk, reception, just very basic, as well as I think it was an insurance position that I was debating between the two. And I just kind of went with my gut and said, let's try dentistry. And so I started as a receptionist, grew to a patient care coordinator, and I worked at a practice near downtown Seattle for about 5 years. It's really where I had my first dental home, if you will. Grew to be a treatment coordinator and eventually an office manager. So I had the pleasure of trying out every single role at the front desk and figuring out what I was good at, what I loved, what I didn't love as much. And then I moved to Phoenix away from Seattle a little over a year ago. And when I got here, I knew that I still loved dentistry, but I thought to myself, do I want to be an office manager? Or maybe the best part of that role for me really was training others and helping the rest of my team succeed in their roles. And I was fortunate enough to meet you, Suzanne, and we met for coffee. We really clicked. And then when you joined Shared Practices, you brought me right along with you. And so right place, right time. And I feel really, really lucky to be here for sure.
We are so lucky you actually went with your gut. Share a little bit about our vision together for what this episode could turn into eventually.
You and I have just been talking about a lot of the hot topics in the industry right now. I'll call you about once a week and kind of give you a rundown of how my coaching calls are going and what questions are coming up. What are the trends that I'm hearing most often from clients? And we as the coaching department, we do see those trends. What are our doctors asking us the most about? And you and I said, hey, let's do an episode, kind of, get our audience a little bit more acquainted with the coaching department. And in doing so, let's hit maybe the top, 4 to 6 questions that are coming up most often on our coaching calls.
Yeah, I love that. So I'd love the opportunity to expand the audience as well, to include team members, because I feel like there is, there's such a demand there for some of the particular things that we coach our clients on. I kind of get a sense of we should call this a little bit of a Coach's Corner. How does that sound?
Coach's Corner. I love that. We get our own segment.
As a kid, I remember watching hockey with my dad, and it was kind of like this Coach's Corner. And so as I toyed around with certain ideas and maybe titles, maybe we should throw that out there. What does the audience think about Coach's Corner? As we were talking about some of these questions, we've been talking to the team members here at Shared Practices about certain questions that we thought would be, appropriate for this first segment.
The first one that really comes to mind is, should we be doing a team huddle? Is it important? I think some offices are doing it without fail every morning, and it's efficient and effective and actually does help the day run smoothly. And other offices feel like maybe it's not really worth it. So I would love to ask you, Suzanne, in your experience, is it absolutely necessary? And if so, how can we make sure that it is effective? So let's jump right in. I think one of my first hot topics that I really was hoping we could address today, Suzanne, is team huddle. What do you think about that? Is it worth it? Should we do it? I'd really love to hear your thoughts on that.
Do most of your teams do huddle?
It's a mixed bag. I get to actually go into a few offices local here in Phoenix once in a while, and I've seen some really effective, efficient huddles. They start right on time. It's 10 minutes. We go through the meat of the schedule. Where can we add today? And they get in, they get out. But some of my offices, they do struggle with it. They often end up not doing it really because they're not sure if it's even worth their time,
Mm-hmm, mm-hmm. Well, I think that's key, right? It's the worth it time part. I think they value the time that they get a sense of like it being worth it. And I think where it tends to not be super popular is like if we ask them to actually be prepared ahead of time, that kind of like reduces, I find, the popularity of the huddle. So what is it like in terms of time frame? Like what have you recommended that teams reserve?
I think 15 minutes is a great goal. And you're right. When we do add, I'll go in and coach and say, hey, here's some forms, hygienists to help you prepare for this huddle. And no one likes homework, right? But if we can get them to see the value in that, really the whole team gets to collaborate in a huddle and say, let's look at the schedule for the day. I've come prepared. The hygienist is looking in their column and saying, oh, Mrs. Jones looks like does have some outstanding treatment. I see that doctor does have an opportunity to get that started today. I'll go ahead and offer that. Does that sound good to everyone? And same with the assistants on the other end, if they can really train themselves to keep an eye out in their schedule for opportunities of overdue recare or maybe patients who have never been put in the hygiene chair in our practice and say, hey, I'm going to help you out, hygiene. I see you've got an opening at 2:00. I'll go ahead and talk to Mrs. Jones about sticking around and getting her teeth cleaned today. So that's what I like to see is let's prepare and hopefully everyone doesn't mind preparing because we're helping each other out,
Right. And I think that's where that time becomes valuable if we can look at same day opportunities as well. So I think those teams who are not at least spending, I would say, I agree, no more than 15 minutes in the morning, you should be able to get in and get out and really, iron out anything that may also occur throughout the day. Like if there are any chaotic points, then you get to talk about that ahead of time and everybody's ironing that out before it happens. Then I think it becomes a valuable time together.
Yes. And one of the objections I hear a lot that I'd love to get your opinion on is the concept of, I don't want to do a huddle because my team always gets off topic. How do we get them to really zone in on the day ahead and focus on the patients and making the schedule flow?
So I know that the dental intel huddle that we have available for our clients is a great way. It kind of serves as an agenda. I feel like they can use that as an agenda. But anybody not using dental intel out there, I think that's one of the things that I would recommend is having an agenda and then everyone have a part to play in that huddle where you've got a few minutes. Team members are, talking about their specific area. And like we said earlier, you need to prepare for the huddle, not during the huddle, right? So I think that sometimes is difficult, right?
Absolutely. And beyond that, another objection, and it could be argued that maybe as team members, we might say, well, I don't really want to do a huddle because we're not all here at the same time. And as a former front office member, and you've worked as a team member yourself, I get that. I do understand a lot of us do have staggered times that we get in for the day. What would you recommend for a team that, I guess, is staggering and maybe one hygienist is there an hour early and one front desk comes in to start the day and then the rest of us kind of trickle in?
Well, I think the ideal, I have tried many different approaches, like let's do it the evening before, let's do it lunchtime. But I feel like everybody's fried at the end of the day, the day prior. Everybody wants to go home, so that hasn't necessarily worked. Or taking lunchtime time during everybody's lunch isn't
Right.
super popular either, right? So
Right.
I feel like as many team members as can be there. And then either if there's an office manager in the practice, then the office manager can relay the information to anybody who wasn't there, or the team lead can relay that information as well. So I feel like there's always some kind of opportunity to at least get together with as many as can be there. We all hate going in extra early, but as a team, if they're starting to see the importance of it and getting benefit out of it, then I think it's a lot easier for a team member to wake up a little earlier, right?
Yes, you actually just brought up a really good point that I kind of want to segue a little bit into. You mentioned the office manager as it pertains to the huddle. I have really seen success with office managers leading that huddle, whether it's your office manager or your treatment coordinator, whoever it is that you want to elevate as a leader in your practice. Could be that your team lead and the assisting side is taking over at some point. The huddle is a good opportunity, in my opinion, for the doctor to take a step back and not be the leader all of the time and really let his or her team shine. As well as, the team then gets to see these leads in their element, really, taking initiative and helping everybody with the flow. It's a great way to introduce a new office manager or, a newly promoted team member and let them shine. And the doctor can really take a step back and just kind of watch it happen and enjoy the collaboration. And then at the end, I just recommend that the doctor ends on a positive note, I would say.
I agree. Have you seen, again, talking about dental intel, I noticed that there's a great motivational segment involved in that. Did you
I've seen
taken a peek at that?
Mm-hmm, mm-hmm. Yeah, the dental intel actually has one thing I do love about that software that we've began using is the morning huddle. To your point, it's laid out really well, and I also love that they can edit the metrics based on the need of the practice. So, dental intel will say, "Hey, here's the top 9 metrics that maybe are most common for a huddle," but there are many more to choose from, and you might say, "I don't want my team focusing too much on gross production. I'm going to switch that over to net production," or maybe one of our main KPIs is new patient pre-appointment rate. I'm going to make sure that's in our morning huddle. So you can really customize that within Dental Intel, which I think is highly valuable.
Mm-hmm. Yeah, I agree. So talk a little bit about your experience with the software and with your teams recently. In terms of, some of those common questions, if we continue along that theme that we have going with questions.
Yes, the office managers that I have trained on Dental Intel, Dental Intel has their own DI Learn, wonderful folks there at that company that are willing to, get on a call with your teams and kind of go over everything with your office managers. But I've sort of taken the time to get them set up with their settings and really show them how they can make it valuable for their particular practice, because I know their practice so well. And honestly, once I've taken them through everything, I've heard, I think it's about 3 office managers now say, "I love this website." It used to be that they would have to pull those reports from the day before from within their practice management software, and they would have to manually write down, what was our production yesterday, our collections yesterday, how many people left without an appointment. I mean, if you really wanted those golden nuggets of information to be relayed to the team, it would be on the OM or whoever was leading the huddle to find that out and maybe write it on a whiteboard or something like that. So for them to have this software that really makes it so easy to read, easy to visualize with graphs, I've heard nothing but good things. Once the settings are in place and you really go in and tell Dental Intel, here's my providers, here are the clinical hours that they work, and we kind of set that hourly goal for them within Dental Intel, you get over that initial hump of getting used to this new website. And then honestly, it's been smooth sailing from there. I think they've really appreciated being able to pull that up and just, whether it's a large monitor in the break room or wherever it is that they're doing their huddle, it takes a lot of the busy work out of it. And all you have to do is kind of bring your brain power of having looked at the schedule ahead and a couple of those pieces of, hey, looks like so-and-so is due for a cleaning. We'll talk about that today.
Yeah, so talking about dental intel, I kind of feel like there's so many metrics and areas that we can hone in on. But I think this brings to mind one of the areas that I often, I'm kind of seeing this being a hot topic. So I wanted to bring up cancellations, no-shows in practices, especially after this, tough year we've had. I feel like this is a real hot topic right now. Are you getting a lot of questions about how to deal with these last minute changes in the schedule?
Oh, yeah. Yep. I would have to agree. I am hearing that a lot. And, we all know we can't 100% prevent a no-show from happening. We can do our very best to have the strongest confirmation system in the world. A lot of us are using a third party to send out the texts and the emails and, make sure patients are aware of their appointment. They're confirming digitally. And so sometimes we don't have to go the extra mile to call them ahead of time. But when you've got a great confirmation system in place and the patients are aware and most of them are confirming, and if they're not confirming, maybe you also have a team member that knows it's on them to call 2 days in advance, make sure they're all confirmed. The question then becomes, I feel like I'm doing everything right. So what more could I possibly do beyond this system to get these patients to show up? And Suzanne, you and I have talked about this at length because it is a hot topic. It comes up all the time. So I'm curious, what would be your first answer to that question when someone brings it to your attention?
Well, you nailed it when you said, we can't eliminate completely, right? Mm-hmm. So we're learning how to deal with last minute changes. And I think this has always kind of been a problem in dentistry forever. But I think it's been exacerbated. Do you feel like during this time, we've not wanted to push too much? Like we've tried to be, understanding of patients as they're dealing with either I haven't been vaccinated yet or I'm not feeling well. And so we're getting a lot of questions about this. And I kind of feel like this is an excuse that some of our patients are using during this time. But at the same time, I think it's important that we deal with this, and so what's happening chairside prior to, are we building value? Is the patient understanding what the next step is in terms of reserving that appointment? I like to use that language a lot. I teach the teams to use the reserved so that we try our best to proactively make sure the patient will be back in the chair. So there's an area of concern that we're communicating to the patient so that they leave knowing why they should be here in 6 months.
Right. And that's really what you and I mean when we say building value. Sometimes I think maybe to our audience and maybe even to our coaching clients, they hear us say, well, build value. And maybe they want us
and that's a big word, right? What does it really mean?
Yep. So you kind of briefly touched on it, but let's expand on it even more. When I say that I want your hygienist to really know how to build value chairside, it is that area of concern that I talk about and saying, hey, identify somewhere in the patient's mouth that you want to keep an eye on. And whether we want to see them back in 2 weeks in the doctor's chair for that, 3 months, 6 months in the hygiene chair, putting it in the patient's mind that, hey, I'm concerned about this. I'm going to take a photo or an x-ray or both, and doctor will be in shortly for your exam, and he or she is going to reevaluate that area that I am concerned about. Some of those key words, they sit well with the patient because it's being reiterated more than once. You say it in the onset of the appointment, and then the doctor comes in and say, hey, hygienist, how are the teeth today? How are the gums? And she say, hey, the gums are actually fantastic. So-and-so has been flossing. But I did mention that I was concerned about that dark hue on the upper right. So Mrs. Jones is aware that you're going to be reevaluating that in your clinical exam today. And really tease the doctor up to to assess that. And maybe it really isn't a big deal just yet. Maybe it is a watch, but the patient leaves that chair going, oh yeah, I better come back for that 6-month cleaning. And beyond that, it's all about documentation too. So when we build value, we're also building value for our front desk to help us keep these appointments on our schedule. So when I'm doing team trainings, and we as the coaching department do team trainings, it's all about really making sure that area of concern, next visit, however it is that you do this, is truly documented in the chart notes, so that when that patient does call in 6 months and something has come up and they just can't make their appointment, we walk a fine line, right? It kind of goes back to, do we just say, yeah, we understand it's because of the last year and everything going on? We can be understanding, but let's not let the patient off just so easily that we're kind of conveying, I guess, that our time isn't valuable. And so one way that I think the front desk can do this is, let me quickly pull up this patient's notes. It looks like Anna wanted to see them back for that upper left crack. She was going to make sure doctor reassessed that. So then the front desk has a tool to say to the patient, oh my gosh, I'm so sorry that you can't come in today. I know Anna was really looking forward to seeing you and reevaluating that such and such area. And then the patient's going, oh yeah, wasn't just a cleaning.
I think
so that's what I mean.
I think just not making it easy, right, for
Right.
patients to and what do we hear most often? Like, we're so nice. We often hear, hey, no problem. Can you come in next week?
Right.
And so I think that's a tough one for team members to sit back, and not necessarily want to fill the schedule. Because I get it. You want to fill the schedule the next week or for the next day. And so if Mrs. Jones can't come in today, our inclination naturally is to say, hey, can you come in next week instead? And so I think what we're doing is then continuing to get this ball rolling by sending the wrong message to the patient. So patients basically telling their family members that it's easy to get an appointment in the practice, or don't worry, just call the practice and they can reschedule it pretty simply. So I think we end up sending that wrong message that way.
Mm-hmm. Yep. It's just all about balance, I think. And
Yeah.
I think this will be a revolving door of a conversation, because you really want to walk that fine line between, I have room for new patients, I have room to accommodate my patients. Yes, choose my practice. We're here for you, but also respect my time, and my providers are busy. And so I think we'll probably continue to have this conversation in the industry, but I like that we got a chance in this conversation to really highlight on air, keeping the schedule full is not solely on the front desk. And so it does start chairside. So I'm glad we kind of touched on that today.
Mm-hmm. I agree. What about the assistants, though? We talked about front office. We talked about hygiene. So what is it that we're talking about when it comes to assistants, and how they can also help that?
Yep. I think it's very similar to the hygienist role when an assistant is seeing a patient for, whether it's new patient exam, limited exam, maybe they're coming in for a filling, but there's more work to be done. This is where I'm a huge believer in intraoral cameras. I think that's no secret here at Shared Practices. We see the value of taking a photo of pretty much anything. And so if the assistant can really take that initiative to see the patient, sit them down, and while they're waiting for the doctor, bring up other parts of the mouth that maybe could be a little bit suspicious, or say, hey, you know what, Mrs. Jones, I know doctor's going to want to reevaluate that in your exam today. I'm going to take a quick PA of this as well, or I'm going to take a photo of this as well. Really just preparing for that exam and making the patient aware, the same way I asked the hygienist to prepare for that exam and kind of plant the seed. As an assistant, you don't really have to say too much beyond, I just want doctor to take a look. I know my doctor will want to take a look. And then there's, of course, the patient education aspect of that, because as we know, doctor might come in and say, yep, here's what we recommend. And maybe doctor leaves, and we know that patient will immediately turn to the hygienist or the assistant, and really give your assistant that opportunity to represent you in that moment. What does the assistant think? So I'd like to actually ask you, Suzanne, what would you recommend we kind of train our assistants on when they do get put in that position of, now I need to make sure this patient knows that I see the value in the work that we do here in my practice?
Right. And, the assistant's role, I think, is sometimes lost. We do a lot of coaching with the front office. We do a lot of coaching with the hygienists. And I want the assistants to feel like they also have an impact on patients' health. So you mentioned the intraoral camera, you mentioned, looking at areas that are either pending or that have been discussed in the past. I also want the assistants to really feel like they can be empowered to look at what the next step is for patients, even on the hygiene side. One of the things that happens is you either see an emergency patient or a patient that isn't scheduled ahead for hygiene. They're on the doctor's side. And that conversation that is happening even after the doctor leaves the room for a minute to go do a hygiene exam or has anesthetized and gets up, here's the chance that the assistant has to have a real conversation with the patient. So, we're looking at whether or not they're scheduled in the future for hygiene. And so the assistants can really, really impact that.
Right. You're right. I would say that when we're looking at how to empower our team and get them to, not only come to work, clock in and do their specific job, is, how do they feel like they're a part of something bigger in growing our practice with us? And that is exactly the way that they can uplift their value and elevate their roles is by zooming out. It kind of goes back to my point earlier about it can be very easy as a provider to walk in and only focus on your patients for the day, and just getting that done. All you want to do is run on time, get them taken care of, get the day over with. But can we dig a little bit deeper and spend our downtime while we are waiting for doctor or whatever it may be, chairside when the assistant is alone with the patient, and do some more research and really talk with the patient about what they could come in for next visit.
Let's talk team meeting, because we've talked huddles, we've talked team. Let's talk team meeting. I know that too is a question that even our coaches are asking in terms of like how to set up those team meetings. How often should we do that? What do we coach? Tell everybody what we coach at Shared Practices in terms of team meetings.
When I'm first starting that conversation about a team meeting, I do like to look at the size of the team. If you are running a solo practice, you might not yet have team leads, department heads. And so your team meeting may look very much like, hey, once a month as a whole team, we're all going to get together. All we need is that hour. We are a smaller team, so we can accomplish what we need to accomplish in that time. Where it gets a little bit trickier is as you grow and you do see that need for a hygiene lead, an assistant lead, and a front lead. And we kind of transition into more of the department meetings. And I'd love to hear, we are all a huge fan of traction here at Shared Practices. So Suzanne, I'd love to hear from you. And I know that other folks who are on our podcast talk about how Shared Practices actually holds our meetings, and I think it is truly based on the traction model. So how do you normally roll that out when someone's ready to take it to the next step and they do have a larger team?
Good question. So I think from the traction book, there's kind of a coined phrase that is the level 10 meeting. And you're right, we actually run our company that way. We do a level 10 meeting. We meet on a quarterly basis. And we all get together face to face and really iron out. And I'd encourage our audience to go back to the traction book and, review that level 10 meeting. Just there are specific time frames and segues that are talked about. As the team grows, let's bring it back to the dental office for a moment. As the team grows, and you mentioned department leads, let's talk about at first when, we aren't at that point yet, when the team is a little smaller. How often is the ideal time frame to meet. And I would say at the beginning, as you're implementing new things, as the team is really being assigned different responsibilities, and there's strategies that are being put in place, I would say every other week at the very minimum. And then you can move over to like a once a month kind of a deal.
I want to transition into talking about bonus systems, because, oh my gosh, that is a trending topic. Whether I am looking at dental Facebook pages or I'm on my coaching calls, it's coming up a lot. I have colleagues of mine in the coaching department asking me, what would you say about a bonus for this particular practice? And this is one of those topics that I don't think it's one size fits all. It's not like, we in the coaching department can really say, hey, here is the cookie cutter answer for should you do a bonus or not. So now that I have you here to kind of talk about this, Suzanne, this is a perfect time to ask you kind of in general, like, do you believe in a bonus system? And if you do, when should we be implementing it? When is it appropriate? And not to pack too much onto this, but maybe tell me like some practices that you've seen do it well, and like, when does it work?
Yeah, that's a biggie, right?
Yeah.
I mean, we get that a lot. That's a biggie. So I think foundationally, I think it's really important to have foundational principles in place first. I think sometimes we jump to this bonus too quickly.
Mm-hmm, I agree.
And then we iron everything out only to make some changes down the road, right? So my concern, and I really want to be clear with the audience here, is my concern is we don't just kind of turn around and say, okay, we're going to implement a bonus system, just because. I think it's important to, once we get to a point where we've established we've implemented something new, we've got some foundational things in place, then it's kind of building off of that, as opposed to starting off with a bonus program that everybody gets comfortable, everybody gets excited about, and then we have to make some changes. One of the things that often I have seen happen is like when the team then starts to bonus and the bonuses get bigger, then we decide we want to make some changes because we're getting a little bit worried about those amounts growing, right? So I think that's when we get these like panicked phone calls on what should we do. And so there's different types of bonus programs out there. I mean, I think your question, Caitlin, was, do I believe in a bonus program? Personally, and at Shared Practices, we highly believe in incentivizing team members. So I think that's for us something we definitely believe in. But I think when the time is right.
Right. I agree. I want to share with the audience something that I've learned from, I would say, both you and from Matt. You two are my direct leaders, which I'm very fortunate. And I've brought this question to both of you with various scenarios. And one thing that Matt has really highlighted for me is, let's make sure we're not just bonusing as like a Band-Aid or a solution to maybe a bigger problem that we can solve through our leadership. And so often if a client is asking me, well, should I bonus them? Will that make this better? I usually will challenge a client, and I'll say, maybe it's time for a bonus. But if we were to just maybe have this tough conversation with our team member and set proper expectations, and then give them the opportunity to meet those expectations, then we talk about a bonus. Really making sure our leadership is strong and we're communicating effectively before we just kind of like slap a bonus on the problem, if you will. And then you, Suzanne, you've kind of really instilled in me that a bonus is just that. It's above and beyond. So we're not going to say to a team member, you'll bonus if you do X, Y, and Z, something that's very basic, a part of their front office or back office role. It's really put in place for when we go above and beyond, right?
Yeah, like often I'll get a question of, should I bonus a team member, for, let's say, making sure that some particular basic thing is done. And so I say, let's just bonus team members over and above just doing their regular, quote unquote, tasks that are assigned to them. Over and above that is what we're looking at. And so we make sure that the team members' salaries basically are right sized. I mean, that's another thing, is when team members are wanting a raise, then we often get the question, oh, should I implement a bonus instead? And so we look at whether or not the salaries are right sized, and that, of course, based on the area and based on the position. And then if that's in the right spot, then a bonus should be over and above what you're asking the team member to do based on that job description that you've provided the team member. So yeah, what have you been getting lately in terms of questions or comments about bonus? Anything in particular that you'd like to share?
Yes, but before I forget my point, you mentioned let's make sure that the hourly wage or the salary is common to the area. I've actually gotten a question. I think someone heard you say that, and they asked me, how do I do that? And so I actually want to ask you that. For me, I go on Google and I just look at Houston, Texas assistant job and see what Indeed is offering, like what these are kind of the range are. Is that how you do it?
Yeah, there's been different apps out there, or different sites to go to. Salary.com is a good one, plugging in the zip code area and just looking at that particular position, typing in dental hygienist or dental assistant. You get a lot of good information there, of course. And then just asking the right questions. Sometimes the team members or the doctors know kind of what's in the area that is pretty common. And then looking at that and kind of establishing whether or not the team's in the right spot first and foremost.
Yep. I would say the questions I get around it, to go back to your original question, they're not ever, can I afford it? It's, should I do it? Is my team where it needs to be, to where I'm ready to share the wealth? This will make sense for that. And sometimes you'll find that the team is very well compensated, and maybe money is not always what they're after, but they would feel more appreciated if maybe there's culture to look at, maybe there's team building to be done. There's other areas sometimes that we need to look at before we say a bonus must just be the solution. And I guess that's just really the conversation I wanted to have on air. Is it's not always a solution, but absolutely, I believe in it. I agree with you. And I agree with you as well. It needs to be the right time. And that's the golden question,
Right. I do think there's some research needed, to make that sort of a decision. Right.
And you've mentioned too, it's very important that, okay, let's say we agree. Let's say you've thought about it long and hard. You've owned this practice for a while. The team's in a really good spot. You're ready to go ahead and implement this bonus. How do we do that? I think the number one question is always, let's make sure you have someone who's going to be administering this, right? Is it you, doctor? Is it an office manager? That's huge, because it can be a lot of work. You have to do it the right way, right?
Yeah, depending on what program you actually put in place. There's some calculations, whether that's, in the form of individual bonus, or whether that's departmental, or whether it's a team. I think you want to make sure that it is something that's easy to implement, easy to execute on. And the more complex it is, then I think that
let's keep
that
it
means
simple, right?
Yeah, exactly. Let's keep it simple. But the more complex it is, then that there's a need there for somebody to be administering it.
Yeah. And so what do you think? Should it be team, or should it be individualized? Like, should they be, I don't know, rewarding their hygienists in particular and then the front office and assistants share a different bonus. Like, do you have a specific opinion on whether it should be the whole team or not, or is it pretty case specific?
So I think there's not one size fits all, right?
Right.
I don't know how you feel about this, but I don't think there's just one magic answer to every team. I think it depends on what's being implemented. And I think you can have a combination of all of these things. There can be sort of either individual or / departmental, and then an entire team. I think team members can bonus on different things. So I think there can be a combination. I don't think one size fits all. And I think this is something that that needs to be thought through, though.
Yeah.
Is the point I'm trying to make is it's not just something you just read on Google and just decide, oh, that sounds great, I'm going to implement that.
So I think key takeaways would really be: ask yourself, am I wanting to implement a bonus for the right reasons? Ask yourself, is my practice ready for a bonus to be implemented? Do I have my foundation in place, my team members in place? We're really at that level where we're ready to implement this. And then, of course, it's how do I want to go about this, right? What makes sense for my practice?
Right. And just to add also, is it the right times? The practice, can the practice afford that additional? I think all of this plays into, so it's a long-winded answer to a bonus question, right? Because I think that's how complex it is. That's how complex it is. Absolutely.
Yep. And so hopefully for our audience, they, identified with some part of that conversation as, oh yeah, that's my practice, or oh, maybe it is a leadership thing. So hopefully you can, kind of find yourself within our answer and keep thinking.
And I think our coaches here at Shared Practices are very versed in, helping guide a doctor to making that kind of a decision and implementing the right kind of a bonus program with that team, so that there are the least changes possible as time goes on. Now, when I say changes, I'm not kind of saying we don't make changes to grow that as we meet those goals, but we don't want to keep changing the rules and moving the goalpost, too often, because then everybody gets frustrated, right? When the rules of the game are changed continually.
Absolutely. Yep. Okay.
Well,
I'm really glad we touched on that for sure.
So this is a perfect segue into another question that I know is probably on maybe listeners' minds here, is how to present the idea of a coach. Some doctors reach out to us, and sometimes we get a little bit of angst in I don't know how this is going to work with my team. So is that something that, you've been asked in terms 100%. Of how to present this to the team?
Yep, absolutely. I have been asked that just about every initial coaching call. I think that comes up to a certain extent. Yep. And it's not one size fits all. Every coaching relationship is different, and every practice has a different need, And so sometimes I'm saying to my client, we're not there yet. Right now, you and I have some work to do just between the two of us, as far as whether it's mindset, vision, really nailing down what our plan is. And then we'll revisit, me meeting your front office or whatever that need is. And we'll talk about it at that time. So I guess I want to touch on that is your team doesn't have to know that you are in coaching. It is up to you. But in an ideal coaching relationship, what we do here and what we do best at Shared Practices is that team interaction, And so hopefully we're at the point where you're ready for myself or anyone else in the coaching department to really hop on that Zoom call with your front desk and talk AR or talk reactivation or, all of these topics that we preach on this podcast. You have a coach now to go ahead and implement that for you. And so when I am asked the question of how do I best approach this with the team, I'm always telling the doctor, it starts with you, Right, Suzanne, I think you can definitely attest to that, that we need the doctor's buy-in, and the doctor needs to be really clear first and foremost on their vision, convey that to the team and set proper expectations of what's expected of them, and really set up the coach as a resource. And this is somebody who's going to come in and help us achieve that, right?
Yeah, I mean, you can turn around and say, doctor's going to tell the team this is the way it's got to be. But at the end of the day, I think the way to have a coach kind of build a relationship with the team is really to get to the root of the issue. And if there's a benefit in it to the team member, I think they see that. So you mentioned shared practices coaching, and the way we actually do a lot of hands-on. And I think what we do very well is build relationships with team members. That has really served us from the standpoint of being able to implement these great strategies and tools. And, I think it's impossible for a doctor to think they're going to do all of this alone. One of the things that I hear doctors say, and how excited they are when they start working with us, is the fact that they get some hands-on training. Mm-hmm. And that's a little bit different, right? When you started coaching with shared practices, was that something that you were surprised about in terms of the way we deliver that?
100%. And I can tell you that there's no better feeling than seeing kind of that weight just fall off my clients' shoulders when they say, okay, so my front desk needs to know how to do this reactivation project. So what do I tell them? And I say, don't worry, that's my job. Let's go ahead and set up a one-on-one call with just myself and them. Doctor, you don't even have to be there. As long as you set me up for success and they know who they're meeting and they know, the end goal, I'll take it from there. And you touched on a really good point about building relationships. It's no secret that coaching, consulting, has a little bit of a negative connotation in our industry, especially for team members who have been in the industry for a long time, and maybe whether it was your practice or somebody else's practice they worked at before they came to you. They may have had a negative experience where a consultant or coach came in and laid down the hammer and said, here's where your numbers are and here's where they need to be, and take it or leave it. And one area that we really strive, and I think we do really well, is getting to know your team, getting them to like us, trust us, see us as a resource. Before anything else, my goal is always to get to know your team. And, we want them to see us as help and guidance and support, and not somebody that's coming in to crack a whip and make them feel like they're not doing a good job. So that's key in what we do really well is, hey, maybe the first time I'm meeting the team or, anyone else in the coaching department, we know what the goals that are in place for us. We know what we want to accomplish, but it's that understanding between us and the doctor that, hey, we might not get there this first meeting. I try to set really clear expectations of, if it's going well and they're super excited and bought in and they're so happy you have a coach because maybe they've been feeling like they needed the guidance too, maybe I'm jumping right in and we're talking reactivation or we're talking AR just right off the bat. But sometimes it does take a little bit more time to, get to know them and see where they're coming from. And that's perfectly okay too. It's just kind of all about how you read people, right?
Yeah, you bet. Absolutely. So I think from a coaching standpoint, we have a unique opportunity here to affect some change and support the doctors all around with having some, more hands-on than, than initially thought. So, all right, Caitlin, well, it's been a pleasure to have you here. I want you to tell the audience how they can reach us with particular questions that they may have.
Yes, it has been a pleasure. Thank you so much for having me. I hope to be back soon. And I hope we can do one of these segments again and kind of bring value to our audience with these question and answer type segments.
So why don't you tell the audience how they can actually send in their questions?
Yep. So the email for that will be practiceunderwater@gmail.com. If you have questions that you'd like answered on a future podcast, send them to that email. That's practiceunderwater@gmail.com.